Hospital discharge is a happy moment, but it's also a moment of massive responsibility. Before you leave that ward, make sure you have these 11 answers to avoid complications and long-term recovery delays. Welcome back to Nitya Nurse. Hospital discharge is a happy moment for the patient and relatives, but it is also a moment of great responsibility. Now patient care is shifting from the hospital directly to the family and caregivers. In a city like Mumbai, where travel distances are long, access to emergency care is difficult and home space is often limited. You need to ask the right questions to ensure effective care. Asking these questions helps with faster recovery, prevents complications, and significantly reduces the chance of readmission. Let's walk through the 11 essential questions you need for your discharge checklist. What is the current condition of the patient and the final diagnosis? You need to understand the exact condition of the patient and the full treatment details. Ask the doctor, what is the extent of improvement so far? More importantly, what issues will continue at home that need constant monitoring for a full recovery? On what basis is the patient ready for discharge? And can you explain the details? It's crucial to understand the key findings that have led to the discharge. Ask for the treatment specifics and the exact care required to maintain the patient's health at home. Successful discharge planning depends on understanding every small detail of the transition. Is the patient mentally strained or dealing with psychological trauma? Many good hospitals in Mumbai and Navi Mumbai have psychologists on staff. Ask about your patient's mental health and learn how to meet their emotional needs during recovery. A patient's state of mind is just as important as their physical healing. How do I identify a true medical emergency at home? This is a life-saving question. Ask for every detail regarding symptoms that point towards a worsening condition. You need to know exactly which signs require immediate hospital attention. This expert advice is what will save the patient's life if things take a turn. What is the exact schedule and duration for all prescribed medications? Don't leave without understanding every detail of medication administrations. How many times a day? Before or after food? For how many days exactly? Also ask if previous medication should be continued or stopped entirely to avoid dangerous interactions. What would be the best diet and fluid intake for recovery? A nutritious diet, good hydration are what help patients recover fast. Most hospitals have dietitians who guide you on hydration requirements and restricted foods. It's vital to know which foods to avoid, as some can actually alter the efficacy of the patient's medication. Can the patient exercise and what types of movement are permissible? Exercise keeps a patient physically fit, mentally alert during the recovery phase. Ask your doctor which specific exercises are allowed to aid the recovery process in Mumbai. Physical activity must be balanced and strictly within the doctor's permissible limits. What medical devices and equipment will be needed for management at home? Effective elderly care often requires specific monitoring tools. This could range from BP monitors and air mattresses to oxygen support or feeding tube supplies. Ask if the hospital can help you procure these items or if you need to arrange them independently. How do I care for the patient at home, and is professional nursing support needed? Be clear about whether the patient needs a professional caregiver or trained home nursing care. Utilizing professional home nursing attendant services is a proven way to reduce unnecessary hospital visits and readmissions. What is the official follow-up visit schedule? You should never miss an appointment, so ask for a clear schedule of follow-up visits. Make a calendar and paste it in a prominent place in your home. Also check if any pathological tests need to be done before those follow-up dates. Can I get a reliable emergency contact number? Finally, ask for a phone number that will respond immediately if a medical emergency happens in Mumbai or Navi Mumbai. Whether it's the hospital's emergency line or the doctor's assistant, you need a number that works. Asking the right questions leads to right results. Addressing these 11 essential points before you leave the hospital will empower you to provide better patient care and avoid unnecessary complications. At Nitya Nurse, we are committed to supporting this transition with professional home nursing services and expert caregiver advice to ensure the best possible recovery for your loved ones. Thank you for watching this guide for Nitya Nurse. We are committed to bringing world-class healthcare standards directly into your home in Mumbai. If you found this video helpful for your caregiving journey, please like the video, share it with other families navigating a discharge, and subscribe to our channel for more home care tips. We will see you in the next video.